Hi, it's the nursing professor here. I want to talk to you today about a very, very serious problem that is happening, and it's workplace violence, especially on nurses. Let me take a deep breath before I start to talk about this. First of all, when did the public stop having any kind of respect for nursing? I don't know really when that happened, but it is such a problem today that we have to have a solution to it, because nurses are getting beat up. They are becoming disabled as a result of it. They really are the target of a lot of aggression that is happening in society right now. And I just came up with some things that I think we could do until we come up with a real game plan. All right, so first of all, it's to speak up. If something feels threatening to you, if someone says something out of place to you, it should be reported, because there really needs to be zero tolerance as far as a policy for these healthcare companies. You know, it can't be, they didn't really mean it. Oh, they were upset. No. These things really do have to be taken seriously, because again, people are getting injured from it. So the latest data says literally that 1 in 3 nurses are being abused in some type of way in the workplace. So whether or not it's verbal or a physical altercation or what I like to call a near miss, all of those things need to be reported, and we need to have some sort of uniform way of reporting these actions. Because my thought is that early reporting may deter some of the major things that happen, because if we know that a visitor, for example, is at risk for saying inappropriate things, then that can be addressed before that visitor becomes violent on a nurse. All right, so let's talk about what we possibly can do. So number 1 is to eliminate barriers to reporting. And by that, we mean this: don't make it so difficult. You healthcare agencies out there got a person filling out 3, 4, 5 sheets of paper or sitting at a computer for a long length of time to give you the data that you need. It needs to be something that's uniform from place to place, and that's something that just gets to the meat and potatoes of what it actually needs to be in order for you to have the data that you need to collect. We need to have adequate staffing, especially in high-risk areas like mom-baby, emergency rooms, ICUs. Those need to be staffed appropriately with nursing staff, as well as in some areas, we need security, and security needs to be armed. Because the truth of it is, if you have security and they have no way of protecting other than their own physical body, I mean, really, does that help? We've seen security actually get murdered in hospital settings recently. So we need to really give that some thought. We need mandatory de-escalation training. And this used to be a part of my training years back, where every 6 months we had to learn how to use our bodies in order to help protect us in the event that there was some sort of physical altercation. All right, so it doesn't mean that you got to be, a boxer or anything like that, but you need to understand and know how you can protect yourself in the meantime while you're trying to get help. Zero tolerance policies. If a visitor comes in there acting all crazy, then no, you can't come back. Period. I don't care what's going on. No, you're just not allowed there. Because year after year after year, I think since like 1980s, nursing has been considered the most ethical profession that is out there. So why is it that people feel that it's okay to transfer their aggression to us? It's totally nonsensical, and it has to stop. I see that lawmakers actually have something. There was a bill created in Congress. I don't see that it has passed yet, but if any congressmen out there, I know y'all are busy right now, but that might be something that needs to come up on the list of things that you need to do. Some of the other things I thought about were panic buttons, very similar to, the button the lady says, I've fallen and I can't get up. Maybe some kind of panic button like that we have on our person that will alert a team that will come to assist us at the time. Any type of alarms, more security, metal detectors. I've seen metal detectors in long-term care facilities, and they might need to come into the hospital setting. It's sad, but it's true. More cameras. If you are a nurse, know your exit. Know how to back out of there. Don't turn your back on someone, in order to get out of the room. And last but not least, I'm going to tell you, never be so sure, never be so confident that, you think that you can handle things. Because let me give you a quick story that happened to me when I did home care. I had been going to a home 3-4 times a week for a stage 4 wound for a patient. And this patient was kind as he could be, but I did notice something was strange in the house, and that there was a sister who always showed up around 1st through the 3rd of the month when this man got his disability check. Her behavior seemed very inappropriate to a brother, so it looked to me like she was taking his money. And there was a lot of traffic in the home. Very big house, but there's a lot of traffic, a lot of just different faces all the time. However, I just went in, did my job, and left. Well, on one occasion, there was a situation where my patient's brother had a grand mal seizure in the kitchen, which was right outside the room where I treated the brother. Now, he's flapping all over the place. So I called 911. 911 came, and, in my area first comes when you're calling an ambulance, then the fire department comes. So the fire department came, and, they got the man together, gave him some Valium, and the seizure stopped, and they took him off. Well, a couple of the firemen stayed back, and I was talking to one of them, and they was like, "What are you doing here?" And I said, "Oh, I'm the nurse for, my patient." And they was like, "What, do you know what goes on here?" And I was like, "No, I just come in and out 3 times a week to take care of my patient's wound." And they told me that this was a crack house that had been a known prostitution ring, and all these clients was who I was actually seeing. Now, I gave it no clue as to what they were doing. It felt like I didn't feel threatened. However, hindsight, I think back and I say, these things were happening right around me, but I didn't pay it attention. And so I bring that story up to you, in that many times we can become so engaged in our work that we forget about those possible threats that may exist. Fortunately for me, nothing happened. I reported it, and the nursing agency did protect the nurses and pulled out of that case because of the possible threat. So this is what I want you to understand, that these things are real, that if you even have something where someone curses you out, that should be reported. Just as we report other near misses, that should be reported. So at least it is on the radar that this person has this behavior that may escalate to being a problem. So if you have any other ideas about how we can protect nurses from workplace violence, drop them down in the comment below, because I'd like to hear what you have to say. I know the ANA is out there, saying something. All these state nursing associations are saying something, but we really, really do need a solution like yesterday. All right. So I hope that helps. If you like this video, thumbs up, share, and I'll see you next time. Bye for now.